Good evening, viewers. I am Dr. Swapna, practicing ophthalmologist from Vijayawada. Today, in this video, I would like to address the importance of comprehensive eye health checkup. We have heard about the general body checkups and cardiac checkups, but what is this comprehensive eye health checkup? I will just give the details to you. Comprehensive eye health checkup includes everything like checking your visual acuity, that is how your sight is, and then checking your intraocular pressure and checking the sensitivity of your nerve, optic nerve, and checking the status of your retina. Retina is a very important layer in your eye, which is the main focused layer which will help in your vision. So checking the status of all these layers and all these organs of the eye annually is very important. So coming to the comprehensive health checkup, so it is usually advisable to do the comprehensive eye health checkup yearly once. Why this is useful? Because some people globally, the incidence of diabetes and hypertension has increased a lot. So generally, the chronicity of diabetes and hypertension will lead to retinal changes, and it will lead to hemorrhages, clotting of blood, and decreased sensitivity of the eyes and all these other conditions. So having an annual eye health checkup will give us the details of the damage of retina, especially in these individuals. So they say in Telugu, Sarvendriyanam Nayanam Pradhanam, which means the eye, out of all senses, the eye is very important. Because whenever there are very subtle changes in your body, they will get represented in your eyes. Like if the patient, if somebody is suffering with anemia, that is blood loss or less hemoglobin, that will reflect in your eyes like paler. Your eyes will look very white and pale. So if somebody has some liver problem or fatty liver, that will represent as icterus, that is jaundice. And that will also get initially represented in your eyes. So like this, the eyes are the main index of the condition of your body and also sometimes the mind. So globally, billion people are suffering with blindness. So out of this blindness, the most common causes of blindness now is, the first one is refractive errors. Refractive errors means the short sight and long sight and others. And the second condition, globally, 1 billion people are suffering with blindness. So out of this, the most common causes are refractive errors and cataract, out of which these two are, they are preventable and they are very much curable conditions of the eye. So if we neglect these conditions, it will definitely lead to the blindness. So this October, we have, all of us have celebrated the World Sight Day. So this year, the International Agency of Preventive Blindness has come up with a theme called Love Your Eyes. So which is enhancing or which is emphasizing the importance of comprehensive eye health checkups. And the International Agency of Preventive Blindness has come up with a target by 2030 to increase the 40% increase in effectivity of refractive error correction and also 30% increase in effectivity of cataract surgery treatments. So which is a very good important thing. During these days, for the last 2 years, we've been facing the COVID situation. So in this COVID era, the refractive errors in kids especially have increased a lot. The most common cause being an almost nil exposure, outdoor exposure to the kids. And it's been observed that the vitamin D deficiency and less outdoor exposure to kids will lead to refractive errors. And if they already have refractive errors, then there will be definitely a tenfold increase in their refractive errors. And one more condition which we are frequently observing these days, especially this during COVID era, is dry eye disease. So these two conditions are very much preventable and controllable, like I can say controllable conditions. So we should encourage kids to have outdoor activities, and also we should encourage kids to cut down on their gadget timing apart from their online class, because these days kids are having online classes very much. So apart from their online classes, we should ask them to refrain from the gadgets and exposure to the screen. And also we should ask and encourage them to go outdoors and play. And one more thing is the dry eye. Dry eye disease is quite common, and we have been seeing it very frequently these days because of the exposure to the gadgets. So this dry eye disease also, like with simple precautions and simple measures, the dry eye disease can also be avoided, like cutting down on your gadget time and taking frequent breaks. Whenever you have to work for longer hours in front of the gadget, you have to take frequent breaks, and also frequent blinking, and also the monitor should be at your eye level. So these are the simple measures with which we can get rid of the dry eye. And frequent usage of lubricant drops, which is a very, very important thing. So because usually what happens is the long-term exposure to the gadgets will lead to evaporation of tear film. Tear film is nothing but it's a transparent watery layer which will protect the surface of eyes. So constant exposure to the gadget and illumination will lead to the dryness and evaporation of the tear film. So frequent application of lubricant drops also will help in getting rid of dry eye. So as a summary, I would like to tell you the importance of comprehensive eye health checkup, especially in diabetics and hypertensives, and also especially in the chronic refractive error conditions also. Like annual eye health checkups are very important in diagnosing the damage at a very early stage. And there is one more condition which is called as a silent killer in ophthalmology, that is glaucoma. So glaucoma is increase in the intraocular pressure. So that glaucoma increase in intraocular pressure will lead to the decreased sensitivity of the optic nerve, and also may lead to the complete blindness if we don't address it. So this glaucoma is one more condition which we can diagnose at an early stage with comprehensive eye health checkups. And if we diagnose it at a very early stage, that will have a good prognosis. I can't say it's completely curable, but we can have a good prognosis with early diagnosis and treatment. Thank you.